we always knew Kerala as a state which was praised for one of the best healthcare system and particularly for one of the lowest maternal mortality rates across South India. But it seems like it is faced with a bit of a crisis now, and that being a steep increase in preterm births. According to data from the Health Management Information System, which is HMIS, there has been a staggering 289% increase in preterm births over 7 years, with numbers jumping from 6,916 in 2017-18 to 26,968 in 23-24. I'm doing this story because women are at the kernel, at the crux of this entire story. You know what is also alarming is that the number of preterm births have been climbing steadily, and it became rather noticeable in the year 2018-19 with 13,077, which was 89% increase in just 1 year. Now there are two sides to this phenomenon according to experts. First is, which is a downside I guess, of how women have presented themselves with conditions such as hypertension, obesity and diabetes. And the other, which is good news, and that being advancement in neonatal care technology in the state. That babies born before full term can be saved now. That could also be a trigger for women to give birth before the end of their term. There is also yet another trend which is being noticed in Kerala, and that being delayed pregnancies amongst women who first settle in their jobs and then decide to have babies, and perhaps one of the reasons for preterm births. We'll find out, of course. There is also, of course, an obsession sometimes with the date or the correct time of birth, which may encourage women to go in for a delivery much before the term is mature. But then whatever be the reason, premature babies have always been deemed to be medically vulnerable, unless it becomes mandatory, also due to medical complications. Let me now go across to an expert for more on the reasons for this increasing trend in Kerala. Dr. Lalita Ambika, senior gynecologist and former head of the department at Government Medical College, Alappuzha, is joining us but on the phone line. Dr. Lalita Ambika, can you hear me, ma'am?
Okay.
Dr. Lalita Ambika, tell me something. This is a staggering increase, 298% as it were. And you know, I was reading this article in the New Indian Express, and of course you've been quoted extensively in this. According to you as a doctor, what is the major reason for such an increase, doctor?
See, that is over a period of 7 to 8 years.
Yes.
So this includes two categories actually, natural preterm labor as well as induced preterm labor. Natural preterm labor, the rate is almost the same, a little bit up and down, but the drastic increase is probably mainly due to induced preterm labor. And this induced preterm labor as well as preterm labor due to multiple pregnancies. So assisted reproductive techniques, more women are going for infertility treatment, more of IVF fixies, more of multiple pregnancies are there. So that contributes significantly to preterm labor. Then due to lifestyle diseases like hypertension, obesity, diabetes, more and more women are doctors are forced to induce preterm labor to save either the mother or the baby. So that also contributes to preterm labor. So the natural preterm labor means there are several causes. The incidence is around 10 to 12% in Kerala. It's due to sometimes due to poor antenatal care, people who do not report for proper care, who do not follow. That in Kerala, actually, that is much less, except in certain foci. In general, people have good antenatal care in Kerala. So natural preterm labor is not increasing significantly.
But induced is increasing. I mean, this is what the report says. And Dr. Lalita Ambika, you know, as I see, as we all understand, Kerala has excellent healthcare system. And if you look at the maternal mortality rates, ma'am, Kerala really comes up. although it's now slightly sliding, but I'm sure it will catch up and do very well. I am only worried as a woman about induced preterm labor. Now, I also understand as a lay person that there could be medical compulsions which makes one do it. But what are the cases, for instance, because there is very good neonatal care, I could go for preterm delivery, but the ultimately, doctor, correct me if I am wrong, aren't preterm babies, premature babies medically very vulnerable, doctor?
That is true, but induced preterm labor is not for fashion or anything like that. It is actually due to increasing medical complications. Patients as well as doctors, they are forced to have preterm labor in order, for example, severe hypertension.
Right.
If you do not deliver severe hypertension, uncontrolled hypertension, you lose the mother. The second common cause of maternal death in Kerala is hypertension. So that way, because more and more elderly mothers are there, multiple pregnancies are there, all these associated with, then diabetes is there, obesity is there, all these are associated with hypertension. So you have
Which
more
means
of
that,
hypertension
yeah,
means
which means
more
it,
of induced labor.
yeah, I understand that hypertension means induced preterm, deliveries, but which also comes to the crux of the matter is that, Dr. Lalita Ambika, that, which means that mothers to be are not that healthy, because of course in my time we had babies much earlier than other, and it's fine, it's their choice, they are studying, they are working, etc., etc. But apart from that, what about the health of the mother to be in Kerala? I mean, I'm also now reading reports that in rural areas in Andhra Pradesh and Telangana, women are presenting themselves with diabetes. It's become a lifestyle kind of a threat, doctor.
Yeah, same thing in Kerala also. Though the standards of living and the per capita income has increased, parallel to that, hazards like obesity, hypertension, hyperlipidemia, diabetes. Diabetes, the incidence is very high. Every one woman out of 3 or 4 is a diabetic who come for delivery. The incidence is as high as 25 to 30%. So diabetes also, when they are not properly controlled, which requires cooperation from the side of the patient, as well as doctors have to be very careful. But uncontrolled diabetes means baby may die in utero. In such situations also, sometimes definitely diabetic babies preterm means double risk for the baby. But still, when combination of hypertension, diabetes occur, we are forced to induce labor. You cannot wait for baby to die or mother to die because of hypertension.
Well, but
So
doctor,
that
tell
is
me,
one
this
important cause.
rise, this staggering rise as it were, do you think it needs to be controlled? Does it worry you? But, or you think, no, we are just fine, because we have logical reasons for why that is happening. Because preterm labor in a lot of states in India are because of poor nutrition, poor natal care, absolutely anemia, not going to the doctors at all. I mean, there are lots of women out there who are delivering preterm than what they should be doing at 37 weeks or whatever it is, doctor. Does this worry you, this staggering increase in Kerala?
See, already government of Kerala has started lifestyle disease clinics. There are so people can attend there, get advice regarding control of weight, control of diabetes. Even in interiors, villages, such clinics are working, but it will take some time for people to accept that. And actually, the treatment should start from childhood. Childhood obesity predisposes to adult obesity. So, from the very childhood period itself, we have to teach them, have adequate exercise, have healthy diet, all those things. Actually, it is an ongoing process. It may take 1 or 2 decades
Yes,
for the
but
entire
then
thing to
we
get
got to
implemented.
start, because it's about women's health, your health, my health, and a lot of other women in this country. Those who should be healthy, whether they become mothers or not, is not important.